everybody, welcome back to my channel Flora Lily Birth School. My name is Ruth and I'm a certified hypnobirthing instructor and busy mum of 3. And today in this video, I want to debunk some common misconceptions that people have around hypnobirthing. I have been helping couples now for a couple of years, teaching one-to-one to try and help them to have better experiences of birth. But I do often come across people that have the wrong idea of what hypnobirthing actually is. And I think sometimes it prevents people from taking that step to do a course or read a book because they think it's just not for them and they just have the totally wrong idea about what it is. I often stumble across forums or comments on social media where people have a misconception of hypnobirthing, and the types of things that I see and read are coming up time and time again. So let's debunk some of these myths and talk about what hypnobirthing actually is and who it's suitable for. But before I dive into those very common misconceptions, please do go ahead and subscribe to my channel. I post weekly content about hypnobirthing, helping you to work towards having a much better experience of birth with lots of tips, tools and techniques. And also make sure you share my channel with other pregnant people who you might think will benefit from my videos and make them feel more confident and prepared. First one I hear a lot, and it couldn't be further from the truth. I think it prevents people from booking that course or reading that book or looking into hypnobirthing because they think, well, anything can happen in birth. How do I know I'm going to have this wonderful natural birth? I don't know that's going to happen. Birth goes off course all the time, and that's completely true. But what's even more true is that hypnobirthing therefore supports all those different types of scenarios. The whole point of doing a hypnobirthing course is so that you feel confident and empowered to face anything that comes your way. It's about flexibility. It's not about being pinned down to one type of birth or one idea in your head that you want to achieve. It is definitely about being open to all the possibilities. But with everything that you learn, all the knowledge that you gain, all the tools and techniques that you learn, it means that you and your birth partner together are a team and you're prepared for anything that comes your way. It is giving you a set of tools and techniques that keep you calm, keep you grounded, can help you to move through labour very calmly. And when you're calm and in control, it also means that you and your birth partner can make informed choices together without panicking, without freaking out, without thinking, oh my gosh, I don't know what to do. Everything that you learn keeps you extremely centered. And when you are calm and relaxed, you do also have all the right hormones flowing through your body. You have your stress response turned off and you can face anything that comes your way. And it's really about being prepared for every possibility, but staying in control. It can be used for any type of birth, in any type of setting. So whether you decide to birth at home or you end up birthing in the hospital or on a midwifery-led unit, or perhaps you end up having a planned or emergency C-section, everything that you learn can be applied to every single one of those births. You need to ensure that you feel confident no matter what path your birth ends up taking. So another misconception about hypnobirthing that is completely untrue. I think some people think the aim of hypnobirthing is to have a pain-free birth, and that is the form of pain relief. And that's really not true. The tools and techniques that you learn, of course, help you to feel more comfortable. They help you to manage any discomfort that you might feel, but it's not necessarily there to replace every other form of pain relief. And I would never want to give someone that level of expectation because a lot of women end up going into labour thinking that they're only going to use hypnobirthing. And when they then turn to pain relief, they feel like they failed. The tools that you learn are there to try and help you completely relax. Because when you're relaxed, you turn off your stress response, you have the right birthing hormones flowing, and you stop interfering with the process of what your body is trying to do. Hypnobirthing can absolutely be used alongside any other form of pain relief. You do not have to go into birth thinking, I'm going to be a hero and only use hypnobirthing. Do not ever set that expectation. What I tend to suggest to a lot of my couples is to have this ladder of pain relief. Envisage this ladder where at the bottom you have all your hypnobirthing tools and techniques. You have things such as water, paracetamol, massage, And as you go up this ladder of pain relief, the options start to become things like gas and air, epidural, diamorphine. But if you start at the bottom and start with your hypnobirthing technique, start with your breathing and work your way up, work out what your limit is. You might get halfway up the ladder and you're using your breathing techniques and you're in water and you find that that works really well. You might need to go further up your ladder. But hypnobirthing techniques can be used alongside everything, because even if you end up having an epidural, those breathing techniques, those relaxation techniques are still going to keep you very calm, very relaxed and extremely in control, which is what you need when you're facing birth and what you need when you're facing very important decisions. The aim of hypnobirthing is not to have the perfect birth. What is the perfect birth? That would be my question. What is the perfect birth? Everybody's birth is completely different, and one person's amazing birth might look very different to somebody else's, because actually it's about how you feel, not actually what has played out. So no one should use hypnobirthing thinking that they're going in to have the perfect birth experience. What we should be working towards is being able to have a calm and positive birth where you are in control and can make decisions. The whole point is that anything can happen in birth, and we know that. And when things do go off course, you have the ability to remain really calm, but also be really flexible, because you've got so much knowledge now, so many different tools and techniques to keep calm. You've got a deeper understanding, you know the right questions to ask, you know how to navigate your birth with your partner as a team. So even if plan A, you wanted a home birth, but you go on this long journey and end up with an emergency cesarean, because of the hypnobirthing preparation that you've done, you've remained completely calm on that journey. You've been able to make informed decisions with your birth partner. You've remained really positive and really in control. And as you've headed into that C-section, you've still been able to express your wants, your preferences, and you've still been able to create a really wonderful experience that you are a part of. If you ever take a course or read a book where hypnobirthing is promising a pain-free birth, know that that is just not true, and never go into birth with the idea that you're going to experience something that's pain-free. The reason I say this is because it is such a physical task to birth your baby that there's always going to be some element of pain involved. What hypnobirthing is aiming to do is try and make you feel more comfortable, but also give you the tools and techniques for you to be able to manage the pain more effectively. Sometimes when we go into labour and birth and we haven't prepared, and I've been there, I've just panicked at the pain and I haven't known what to do at all. But once I've had tools and techniques in my back pocket, I've been able to manage it much better. I've been able to know what to do with my body, how to get through it, how to stay in control. So it's not about saying this is going to be completely pain-free if I relax and breathe. It's not about that. It's about being able to stay in control, being able to focus, knowing how to get through those sensations and feel more comfortable. It's also important to note that, you know, in things like sport, we experience a level of pain, whether we're squatting or working out or running, there is an element of pain. So we have to know that we're going to experience some kind of pain in birth because it's very similar. It's not a pain of harm, it's a pain with purpose. When you're working out, the purpose of the pain is to get fitter, work your muscles, and the purpose of pain in your labour and birth is your uterus muscles contracting so that it can bring your baby down, and your body is working to bring your baby to you. Therefore, we will experience a level of discomfort and a level of pain. But hypnobirthing is all about helping you to manage that. We also need to remind ourselves that we all have a different pain threshold. We all have a different idea of what pain feels like. And, you know, if I stub my toe, the way in which I describe the level of pain might be different to somebody else. So we can't ever really understand what level of pain we're going to experience until we've gone through it. It's going to be a slight case of not knowing what it's going to feel like until you get there. But if you get there and you're like, oh my gosh, yes, that's painful, but let me reframe my mind around this, and let me see how I can work with my body. I've got loads of different tools and techniques that I can use to focus and get through this. This misconception that perhaps hypnobirthing is only for first-time mums who are giving birth for the first time in complete fear and anxiety, and that's not true either. I used it for my second and third birth because I had no idea about it for my first. So a mum can come and do a hypnobirthing course at any time for any pregnancy. It's not just about going into birth for the first time, not knowing anything. It's about getting a deeper knowledge, a deeper understanding of birth, perhaps looking back on previous births and recognizing why things didn't go to plan or why you were out of control. It's never too late to learn more tools and more techniques for birth. It's never too late to get more of an understanding of your body and what's happening in the process, and just to gain more control with your birth. Feel more empowered, feel more positive. You can never have enough information about birth, in my opinion. This one is a big misconception, and I have had people in the past who have contacted me and said, oh, I'm not going to do the course anymore because I'm having a cesarean, there's no point. But I also have had clients who've got halfway through the course and then they've been told they're going to have a C-section, but they've continued with me and found the information really valuable. The reason why I say a hypnobirthing course is still extremely beneficial for someone who ends up having a C-section is because a lot of the time people end up going into a C-section with very little knowledge. They're full of fear and anxiety because it's major surgery. They don't know what to do. They're behind a screen. They can't see anything. And it can be really stressful and uncomfortable. By learning hypnobirthing and the tools and techniques, you can still use these before the cesarean. It keeps you really calm, really positive. Again, keeps that stress response turned off, and you still have the right hormones flowing around your body, which is beneficial for baby. And then when you get into the cesarean, you can use the breathing techniques and the relaxation techniques during the procedure. It's also really important to be aware of the fact that you can still take control of that birth. You can still very much be involved. There are a lot of preferences that you can have a say in to make it a really lovely experience. Did you know, for example, that you can have a gentle cesarean, perhaps where the screen is down and you've got lovely music playing and the lights aren't so bright? There's different things to consider and think about, and you can still very much be a part of that experience. And all those tools and techniques really help. And they also help after to aid with your recovery and how you're feeling and to get the right hormones flowing for things like breastfeeding. You should feel empowered and in control no matter how your baby arrives. So there you have it, 6 common myths about hypnobirthing. Debunked. Hypnobirthing really is useful for every type of birth, and I would never want anybody to go into their birth with a level of expectation of this perfect birth where it's pain-free with no interventions. That's not the case. Everything that you learn in hypnobirthing is going to keep you really centered, really calm, really grounded, and you'll be so full of knowledge and understanding, and you'll feel so empowered that you'll be able to face any path that your birth takes. So if you'd like to learn even more about hypnobirthing and how you can use it to have a more positive and empowered birth, then go ahead and subscribe to my channel. Please do share this channel as well with any of your pregnant friends. The more we can spread the word about how they can have a more controlled and positive birth, the better. And if you've heard any more weird and wonderful things about hypnobirthing, any other myths, or if you have any questions that you want answered, then just drop them in the comments and I will promise to answer you. But for now, thanks for watching, and I'll see you on my next video. Take care. Bye-bye.